right. Good afternoon, everyone. Thanks. We have the pleasure of having Miss Elizabeth Hart here with us this afternoon to talk to us about health disparities and what we need to do to try to close the gap on those disparities. So what I want to do first is start off with a scripture and a prayer. I want to come to you now from Psalms 103, verses 1 through 5. Bless the Lord, O my soul, and all that is within me. Bless his holy name. Bless the Lord, O my soul, and forget not all his benefits. Who forgives all your iniquity, who heals all your diseases, who redeems your life from the pit, who crowns you with steadfast love and mercy, who satisfies you with good so that your health is renewed like the eagles. Let us pray. Heavenly Father, thank you for bringing Ms. Elizabeth Hart to our presence this afternoon to give us some valuable information on bridging the health gap, Lord. May this information reach as many folks as we can get it out to, so they can have this information to improve their quality of lives. In your name we pray, amen. All right, just like I said, we have Ms. Elizabeth Hart. To give you a little bit of background about Ms. Hart. Elizabeth Hart is a graduate of Alabama A&M with a BA in Communications and is currently in the midst of receiving her Master's of Science in Communications from Middle Tennessee State University. She is currently the Director of the Office of Faith-Based and Community Engagement for the Tennessee Department of Health. With more than 17 years of experience working in medicine and public health communications, Ms. Hart's dedication and love for the well-being of others has helped agencies such as the Indiana University School of Medicine, Indiana State Department of Health, Shelby County Health Department, and the Tennessee Department of Health, and have great success with public engagement and outreach. Ms. Hart has led public education campaigns to increase breastfeeding, immunizations, prenatal care, proper sleeping positions for infants, and workplace health initiatives, in addition to disseminating information about health threats such as influenza, the Zika virus, severe heat, opioid abuse, and COVID-19. She received national recognition for her use of social media in public health by the National Association of City and County Health Officials, NACO, the National Public Health Information Coalition, and the annual Government Social Media Conference. In 2021, 3 of the campaigns she led were nominated for Emmys. Such a broad and a lot of accomplishments there, Ms. Hart. So I would like to now turn it over to Ms. Hart for our presentation.
Wonderful. Thank you so much, Mr. Powers, and thank you so much for inviting me.
Opioid abuse and COVID-19. She received national recognition.
I hear a feedback.
Okay. Okay, go ahead.
Okay. Good afternoon, everyone. Thank you so much for that wonderful introduction, and I really appreciate you inviting me to come speak with your congregation and your community. As Mr. Powers mentioned, I am the director of the Office of Faith-Based and Community Engagement at the Tennessee Department of Health. So while I know that you all are located in Mississippi, I know that you are a stone's throw from the Memphis area, which is where I spent many, many years working at the Shelby County Health Department. So I'm very familiar with that particular part of the country. Spent a lot of time down there in that South Haven area. So I'm pretty familiar with your community. So again, I want to just kind of talk to you about the work that we're doing in Tennessee, because it's really not unlike, other states across the nation. And we try to learn from one another, and we try to pass on little nuggets that we've had success in so that others can then replicate it in their own communities. So a couple of things I wanted to talk about, but first and foremost, I would be remiss if I did not start with talking about COVID-19 and vaccines and the importance. Well, we all know that it's important, right? We know that we have now been in the midst of this pandemic for almost 2 years. I think it is very hard to believe. I was actually at a vaccine event earlier today that we were hosting. So I've had a pretty long day where we were vaccinating individuals ahead of the holidays. And let me tell you something, it is incredibly important for everyone that can hear my voice, is watching me on YouTube or watching here on the Zoom, that it's important that you get that vaccine. Not just your COVID-19 vaccine, but also your influenza, your flu shot. That is an annual flu shot you should receive every year. And depending on your age, you might also need to get the shingles vaccine as well as your pneumonia vaccine, depending on your health conditions. Vaccines are safe and they are incredibly effective. One of the things that we know in the last 2 years of living through this global pandemic that prayerfully none of us will ever see again in our lifetime. Let's hope that the next global pandemic is long after all of us are gone. Is that the importance of teamwork, the importance of understanding medicine and science, and why those of us who were science nerds, we've been practicing and studying this for many, many years. We've had years of trainings and, never really thought we were going to see one. We knew it was a possibility. And then, of course, early last year, it came knocking on our doorstep here in Tennessee, and then eventually across the country. I don't have to go over the data just in Tennessee or in Mississippi. There have been quite a few cases, nearly 1 million cases in each of our respective states, or little more or less. And then, of course, the countless deaths that could have been prevented. We know the importance of wearing masks, even yes, still, when you are around individuals who are not in your immediate home, or who have been vaccinated. We are going into the holiday season, and last year, many of us, and myself included, I worked 7 days a week during the pandemic and the heart of the pandemic. And so I spent Thanksgiving, I think I ordered a pizza. That was my Thanksgiving last year. So I'm really looking forward to and excited about spending it this year with my family, including my family that lives overseas. They are actually here in the United States, and we're really excited to spend this Thanksgiving together after what we've all endured last year. The reason why we're able to do that is because everyone in my family received their vaccine. So we know that we can gather safely together in a small group, even indoors, because we have all been vaccinated against COVID-19. We know that COVID-19 disproportionately impacted our Black and Brown communities for a myriad of reasons. I won't go over all of the data or all of the reasons that it did, but let me tell you, we have these things called social determinants of health. You may or may not have heard that term over the last couple of years, the last 2 years that we've been in this pandemic. But I'm going to kind of give you a small breakdown. So whenever you hear this term used, kind of understand what it means. So the social determinants of health, the technical definition, I want to make sure I read it correctly. Social determinants of health are the social, economic, political, environmental, and cultural systems and structures that shape the conditions of a person's daily life. So what does that mean? Okay, let me break it down a little bit. Okay, race and ethnicity. What level of education have you received? Your employment status. Are you employed or unemployed, underemployed? What does your income look like? What is that socioeconomic status that, on those levels? Where do you fall? Your gender, your sex, male or female, or whether or not you identify as LGBTQ, adverse childhood experiences. What was your family life like? That plays a role in social determinants of health. Individuals that are experiencing homelessness, that plays a role in social determinants of health. Food insecurity, we all know about, and inaccessibility of nutritious food choices. We know there are food deserts all over this country, especially in Black and Brown communities across the country. Crime and violence also fall into that category. Transportation, how do you get to and from work? How do you get to and from church? How do you get to and from your child's school, or even to the grocery store? If you live in a food desert, do you have that transportation to get to the nearest store? Is the nearest store down the corner, 2 streets away, or is it a 20 or 30-minute drive? Here in Tennessee, many people don't realize just how wide the state of Tennessee is until you've driven it. And I can say I've driven it. It is a very, very long drive, and especially in rural areas, much like in Tennessee, the same as in Mississippi, a lot of times the nearest grocery store is 20 to 30 minutes away. And then of course, the last one would be culture and language. What again, that kind of goes back to that education component. So those are really all social determinants of health. We know also that systemic racism played a part in COVID-19 and the cases. We know that many individuals who were working on the front lines, because of whether it's your education level or your income level, whether you are unemployed or underemployed, that you were perhaps, or maybe one of your family members perhaps was working on the front line, maybe a grocery store worker, someone who could not actually work from home. So I'll be honest, even though I logged many hundreds of thousands of hours of work last year, the majority of it was sitting in my home or in my office, and that is not the case for everyone. And so we know that played a role in COVID-19. We also know the history, right? Let's just be honest. There is a history in our country of medical racism that we know about. Things that I don't even have to mention some of the historical occurrences that have happened in our Black and Brown communities. You know what I'm talking about, and we know that played a role with helping individuals understand that there are people sitting at the table, not only who look like you, but who are looking out for you. And that's why it was so important, not only in my role in the Office of Communications, but now as the director of the Office of Faith-Based and Community Engagement. And so I spend many of my days and my nights talking to congregations across the state of Tennessee, into our neighbors in Mississippi. I've also talked to folks on the border in Kentucky, because Tennessee is very unique. We border so many states. Many folks who may live on the Mississippi side, or they work in the Tennessee side, or vice versa in Kentucky or Arkansas or the Carolinas or Virginia or Georgia, Missouri. So yes, Tennessee borders a whole lot of states. And so I talked to a whole lot of folks. One of the things that was so important is that I did have these conversations with our minority population so that they could see that I am a member of the Black and Brown community. I am proudly a Black woman here in the Nashville area. And I think it's very important that you hear from me specifically talking about these things. So I would be remiss if I did not start this entire conversation giving kind of that overview and encouraging you all to get your COVID-19 vaccine. Not unlike Tennessee, everyone in the country can go to vaccines.gov. It's really easy. Vaccines, vaccines.gov, vaccines.gov, to find the nearest COVID-19 vaccine to you. There are plenty of vaccines available in the communities across this country. You could actually, right now, if you're listening to the sound of my voice, if you're watching me on, again, whether it's on Zoom or YouTube or another platform, you could go to vaccines.gov right now, and I bet you can make an appointment for this evening. It's important that you get this vaccine. It does take some time for that vaccine to get into your system, to give you that protection. So right now would be a great time to get it. You at least have some protection ahead of Thanksgiving, but you'll have complete and full protection by the time the Christmas holiday and the New Year's holiday rolls around. And that's what's important. We know that as viruses circulate in our community, we have not gotten rid of COVID-19 yet. The cases are still a little bit too high in certain parts of the country. You may have seen that on the news lately, and certainly across the world, we're starting to see some increases. And so we're pretty stable here in Tennessee. We'd like to keep it that way. So we're trying to encourage more folks to get vaccinated, and that's how we can do that. So I wanted to start off with that information about COVID-19 vaccine. As I mentioned, also the flu season started around the 1st of October, and now here we are at the end of November. We typically do see an influx of flu cases across the country in the December, January timeframe. That's because children love to play together. And so, during the flu season, children pass back and forth, and then they bring it home to mom and dad or grandma, and then mom or dad or grandma go to work, and then they bring it back home, and it kind of spreads that way. So again, I wanted to encourage you all to get those flu vaccines. The best place to get your flu shot is anyone that offers it. Your local health departments, I know, no matter where you are in the country, they offer the flu vaccine, but also your neighborhood Publix or your Kroger, your Walmart, your CVS's, your Walgreens. I'm start naming a bunch of folks, but any place that offers the COVID-19 vaccine likely also provides the flu vaccine. So that is important. That is incredibly important for our community to get those vaccines. They help protect you. Now, a lot of questions that I always got when I was in the communications office, and I still get in my new role is, well, you know, I got the flu shot, but I also got the flu one year. Well, you know, first of all, one of the things we know is that there's only two things that we know for certain when on this here earth. You're born and you die. Those are two things that we know are 100% certain. Everything else, the numbers can kind of, you know, shake around a little bit. But what we do know about the flu vaccine, it's going to protect you from getting very, very sick and get hospitalized. That we do know. That's what science tells us. That tells us that if you receive the flu shot, and let's say by chance you also had the flu a couple weeks or a month or so later, I bet you were feeling a little crummy. But if you not received your vaccine, there was a much higher likelihood that you could have become very, very, very ill and perhaps hospitalized. And then unfortunately, we do have a lot of deaths to flu every single year. So we want to prevent deaths, and we want to prevent hospitalizations, and we want to prevent severe illness, especially within our community. So one of the other things that I do in my job, in my role as the director of the Office of Faith-Based and Community Engagement at the Tennessee Department of Health, I lead our Tennessee Health Disparity Task Force. It is an awesome group of people made up of individuals from multiple different organizations and industries across the state of Tennessee. Many also border the bordering states as well. And what we do is we meet once a week, different priorities every week, and then we have a full member meeting at the end of the month, so that if somebody's only interested in one particular priority, that they only have to attend that one meeting and then the final meeting at the end of the month. What do we do? So the group is made up of hospital administrators, nurses, lay people, so folks that are just interested in health outcomes, pastors, faith leaders, rabbis, imams, those that are leaders in the Hispanic communities. Tennessee is very unique. We have the largest community of Kurdish individuals outside of the country of Kurdistan. So that's a little fact that you just learned today on Saturday that you can tell someone. In Tennessee, we have the largest contingency of Kurdish individuals. And so we also have individuals that represent those communities on our task force. Why? Because it's important that we hear from them. It's important that we learn what are the things that they are facing every day when it comes to health, when it comes to access. How do we know how we can fix it or help and provide resources if we don't listen to the people in our community? So I would pause there for a second and encourage you all there in the Walls, Mississippi area, talk with those leaders in your community, talk with your local health department, talk with your elected officials, get on those committees. Many of those task forces that these government organizations hold, that most of them, I can't say all, most of them do have a community component, meaning they want to hear from community voices. Become active, find out how you can voice your concerns. If you live in a food desert, find out how you can sit on one of these types of task forces to let them know, hey, I live at such and such, a street, and Main Street and whatever street, we don't have a grocery store within the next 20 miles. That's also they need to hear that, right? So that's part of the reason why we created the task force. Well, it was birthed out of COVID-19 and recognizing that there was a disproportionate impact on Black and Brown communities. And from that, we learned we really need to be listening more. We need to give our community an opportunity to share. So out of that came the sharing, learning about different populations and communities across the state. In Tennessee, what it looks like in Memphis is not what it looks like here in Nashville. And what it looks like in Nashville is certainly not what it looks like in the Haywood County area, which is in a little west of Jackson, I almost said Jackson, Mississippi, but Jackson, Tennessee. So Haywood County is a rural area. It is predominantly African American, but it's much different. The industry is different. The education is different. The layout of the county is different than it is here in Nashville. And so how do I know that? Because I've made contacts. I speak with Mayor Rawls, who is there in Haywood County all the time. He has me on speed dial, it seems. And he has that open line to us to tell us if there are things that are happening in his community for us to know about. So I want to encourage you all to find out those leaders in your community and for them to help them understand the needs of your community. So that's what our task force does. We are in the midst of creating toolkits. So as I mentioned, we have different priorities that meet once a week. The first Thursday of the month. So if you're interested in putting your own task force together, they are either in your church or within your entire community. I mean, you could create your own task force. No reason for you to wait on a government entity or that health department to do it. You could do it yourself. So one of the three priorities are diabetes, that meets on the first Thursday of the month, mental health, that meets on the second Thursday of the month, and infectious disease meets on the third Thursday of the month. And so what we do in those meetings for chronic disease, we focus on diabetes, we talk about heart disease, we talk about asthma, those kinds of conversations. How can we get the best resources? Do we need to be looking for more funding opportunities for folks to apply? Do we know about funding opportunities for folks to apply? So we can share that with the group. We actually have federal partners that join our meetings as well. So they oftentimes will come on our meeting and say, hey, we just got word about it, a potential award, an application for people to apply for. We have had several folks for our task force not only write and submit applications, but actually receive funding based on the fact that they have been involved with our task force. The second Thursday, as I mentioned, is mental health. We talk about ACEs, so adverse childhood experiences. I kind of talked about that earlier under the social determinants of health. We also talk about access to mental health treatment. We talk about recovery. We talk about addiction. And that's not something we talk about very often in the Black and Brown communities. And we're going to start doing that a lot more. For the reason being, we need to reduce the stigma. There is a stigma in our community. I'm a keep it real person, y'all. So we're going to keep it real. There is a stigma in our community about addiction. And I'm going to tell you a little bit about one of the campaigns that Mr. Powers mentioned that I received an Emmy nomination for. Didn't win, but I did receive the Emmy nomination. And it was about addiction in Tennessee. So we talk about addiction, we talk about recovery, we talk about work with law enforcement. So on our mental health task force meetings, we actually have law enforcement representing multiple different entities. So they are at the state level, so Homeland Security and the like, then also down to the local level. We have a couple of local sheriffs or their sheriff offices who would join the task force. And so they sit in on that and listen to the words of the people. How can they make changes? How can they make policies within their own internal offices based on the feedback from our task force? And then the third Thursday is infectious disease. We talk a lot about STIs. So those are sexually transmitted infections. Of course, in government, we have a acronym for everything. So I want to make sure I spell those out. So I've already mentioned ACEs, adverse childhood experiences, STIs. Those are sexually transmitted infections. So those are your gonorrheas, your syphilis, your herpes, your HIV. And so those are hepatitis as well. Those are things that we have conversations about. How can we create toolkits? How can we, again, reduce the stigma so individuals can not only seek out help and seek out a healthcare provider, but make sure they're getting their treatment so that we don't spread these in our communities. And so that's what our task force does. And it's incredible work that's happening. Because of it, again, I talked about those toolkits that we are creating. We're hoping to get those launched out in the next couple of months, in the first couple of months, I guess, of 2022. And those were going to be really conversation starters, one-pagers for all communities, especially faith communities, to have in their fellowship hall or have at their front office. Things that, No one even has to ask. So they're just out there. Somebody can pick up the one pager because maybe they happen to know someone who's struggling with mental health. Maybe they happen to know someone who's had thoughts of suicide. Maybe they happen to know someone who is probably not taking very good care of themselves and their diabetic needs. You know, one of the questions that's going to be on there on the conversation starter part of these one pagers is, what's your A1C? Have you had your A1C checked lately? How much have you eaten today? How much water have you drank today? When's the last time you had an HIV test? For those that are sexually active. Again, these are the kinds of conversations that we are having, and having those on a one pager kind of helps folks kind of break down those icebreakers, right? When they're talking to friends and loved ones. So we're working on that in the task force, and we are really, really excited about that and the work that we're doing to eliminate health disparities in Tennessee. So I encourage each of you to think about this in your own communities. Create your own task force within your church. I don't think there's any issue with doing that. Get your elected officials involved. Get other community churches involved. Perhaps you do that as a conglomerate. Maybe you've got 2 or 3 or 4 or 5 churches and get everyone involved. Meet once a month, perhaps, and really tackle those issues there in your community. And then, of course, make sure that you are voicing those to your elected officials or to your health departments to make sure they are aware of the things that you are doing. So some other things that we are also doing, we have in my office, we are doing all this COVID-19 vaccine outreach that I just mentioned. We had an event earlier today, and we actually have a couple in the next couple of weeks as well. We are still full steam ahead, and we are very, very thankful to the CDC, again, another acronym, the Centers for Disease Control and Prevention, for loaning us a couple of staff members who are assisting us with that so that we can get back to the work of our office. So we are starting to really get out in the community. So I have been spending time on the road, meeting with community partners, and again, listening to them, hearing what their concerns are and how we can provide resources, how we can provide funding opportunities, you know, giving them access to things that maybe they didn't even know existed. There are a lot of dollars out there. So let me pause for a second. Let me say that one more time. There are a lot of dollars out there, especially right now, for not only minority communities, but faith organizations. There are a lot of dollars and funding for you all. So you just have to know where to look. You have to know who to ask. We, you know, at the Tennessee Department of Health, we are trying to be incredibly transparent. Our website is called healthdisparities.tn.com. And while I know it is for Tennessee, the majority of things that are on there on our task force page, if you were to go to our website, it's again, healthdisparities.tn.com. That is our division of health disparities elimination. Under the Tennessee Health Disparity Task Force, there is a tab that says funding opportunities. We try to keep that updated as possible for anything related to health disparities. The majority of things that we post on there are from our federal partners. I'm telling you this because it is not just for Tennessee organizations. If you want to go on that website and you look on some of those that are on there and they apply to you, apply. That means that there is funding there. Please, please, please take advantage of that. I cannot emphasize that enough. There are funding dollars available for you to tackle some of the things that are happening in our communities. And so again, that's another hat that I wear. I'm also the division's webmaster. So in between, when I'm not on the road and I'm not talking to faith organizations, I'm also the webmaster. So I typically try to make updates once a week or every other week or so. So I also wanted to talk about, the rest of our office. We also have the Office of Rural Health in our Division of Health Disparities Elimination. So they tackle some of the critical access hospitals out in the rural areas, and then work with our safety net clinics. And those are some of the really small clinics across the state. Those are called FQHCs, again, another acronym, Federally Qualified Health Centers. You likely have quite a few health centers there in Mississippi. I'm sure of it. I know for a fact that you do. And then we have our Office of Minority Health. They do much of the same. And as it says, Office of Minority Health, they work with minority populations across the state, again, addressing some of these health disparities. And so the 3 different offices My office, rural health and minority health, we work together to make sure that we are basically working to work ourselves out of a job, right? We are trying to eliminate health disparities. We need to call it like it is and call it out and say, you know what, this needs to happen. We need to do something. We need to put this individual with this organization, or this organization with this individual, or this funding with this organization, because we need to eliminate these health disparities that we know were certainly spotlighted because of COVID-19, right? We know the individuals who were disproportionately impacted by cases as well as deaths were individuals from the Black and brown communities with heart disease, diabetes, asthma, cancer. All of these things we know are the reasons why our community was so impacted by COVID-19. We need to do something about it, right? So November is National Diabetes Awareness Month, which I'm not sure if you are aware. We talk about all the different types of diabetes. So there is, of course, type 1, also known as juvenile diabetes. There is type 2 diabetes, which is the majority of Americans have. In fact, the type 1, there's roughly only about 5% of those who are diabetic actually have type 1. So the majority have type 2. And then, of course, there's gestational diabetes. That is what is developed when a woman is pregnant. And so really want to kind of just talk about that, diabetes during this month, the importance of eating healthy, the importance of portion control, the importance of getting physical activity. One of the things that we talk about even on the task force in our chronic disease group is, there's this whole notion that you've got to go work out and sweat your hair out and, come home and you're completely drenched in sweat and you just can't move and you're stuck on your couch and you can't walk up your stairs. Guess what? In order to get physical activity, you don't have to do all of that. You don't. Just getting 30 minutes of walking in a day will make a dramatic difference. So one of the things I told Mr. Powers when we had talked is, there are things that we are encouraging faith organizations to do. Now, I say this knowing we are now entering into the cooler weather. So take this with a grain of salt, right? There was a pun intended there as we're obviously talking about chronic disease. But during Wednesday Bible studies, we all know there's Bible studies on Wednesdays, right? Or any other time you have a meeting. If the weather is cooperating and everyone has a jacket or a coat on, you could actually walk outdoors in your parking lot, take a couple of laps, maybe start the meeting for 10 or 15 minutes, starting with after you've said your prayer. Perhaps you actually do a walking Bible study, then go inside and finish the Bible study indoors, and you can finish it outdoors for another 15 minutes, having a discussion and a conversation as you're walking with your fellow congregation members. And guess what? You would have just gotten your 30 minutes of daily activity in. That's it. That's it. That's how you get your 30 minutes in. When we think about gathering together and we have, fellowship hall and we're all getting back together, I grew up in a Black church. I know what we eat. So think about pulling back a little bit on some of those items, right? I'm certainly not telling you to have all completely healthy options, right? Let's be honest, because if you do that, then what's going to happen eventually, right? You're going to go back to those other items, right? But maybe you pull back on one. Maybe this time I'm not going to get a big spoon of macaroni and cheese. Perhaps. Again, making small steps will make huge advancements in your health. Those are the kinds of things that we are encouraging. We're also encouraging for young people to get outside. Now, I don't know about you, but everyone's got a phone, right? My phone's sitting over here off the side of the computer. I actually, before we started, I had my Apple Watch on, right? That's how I get my activity. I know, okay, I need to get up and move. I need to get up and stand. I need to go walking. That reminds me, I haven't got my 30 minutes in. But children need the same reminder, right? Because they're sitting on their devices. They've got iPads, they've got Kindles, they've got all the things and laptops, right? We're indoors, but they need to get outside. So go outside with them. Go to your neighborhood park. Walk around your neighborhood. If you don't feel particularly safe in your neighborhood, find a park that does have lighting. Go as a group. Make it a fun activity. Again, go with your church members. That's a great way to get to know other folks, maybe in your community, other folks in your church, perhaps you wouldn't ordinarily speak with after church. Maybe right after church is over, you're making the beeline to the door to get home to that, good home cooking Sunday dinner, right? But maybe perhaps that's a good opportunity for you to meet other folks. So maybe I'm a third rower. So if there's anybody that's watching, in my church in Memphis, Tennessee, that is my home church. I am third pew. Everybody knows that when I come into town, not to sit in my seat, but I don't necessarily speak to or know folks who are in other rows, right? So it's a great opportunity for you to then say, hey, Mr. Seventh Row, let's go take a walk, right? That's a great opportunity to do that. That's a great opportunity to again, build up that camaraderie, not only in your church, but also in your community. So again, this is Diabetes Awareness Month. I know you're going into Thanksgiving next week. I'm just going to be very honest. It's Thanksgiving. However, portion control, portion control, portion control, right? There's this beautiful word that we like to use all the time, and that's moderation, right? We're not telling you to not eat the dressing. We're not telling you to not eat candied yams. Moderation, right? Portion control. So the other thing I want to talk about also is Alzheimer's Awareness Month. November is Alzheimer's Awareness Month. Now, it is something that we also don't talk about a lot in the Black community, but it is certainly impacting our Black and Brown communities quite a bit. That is individuals who are being diagnosed with Alzheimer's. So what I want to do is I really want to encourage you to learn more about it. There is an Alzheimer's Association chapter across this country. There is likely one very near to you. And if you do not have one, I encourage you to reach out to them to try to find one or get one established in your community. But I really want to encourage, if you are listening to me, if you are watching me, to learn more about Alzheimer's, learn more about the signs and the symptoms and how to get into a healthcare provider early when there are early onset symptoms, and then caring for our family members who are aging, right? It's really important that we learn more about this. And again, so much great information out on the Alzheimer's Association page. I am incredibly passionate about this topic. I actually lost my grandmother a year ago to the disease, and I've been a huge supporter for many, many years during her illness, and have catapulted my activism within Alzheimer's since her passing this time last year. So really want to encourage those of you that are watching to learn more about Alzheimer's and how it can impact and how it is impacting our community. So I really kind of want to touch on those couple of items that are happening, but I wanted to end before I allow for some questions on a positive note, right? On the things that we are doing at the Division of Health Disparities Elimination. So as Mr. Powers mentioned, we received several nominations, Emmy nominations for some work that we've done. And that is my background. My background is marketing and communications and medical and medicine and science, medicine and health. That is my thing, right? So now I'm able to do that and now moved into the community engagement role, which is nice because I actually get to talk to real people instead of, people on social media or, creating graphics. And so one of the things that we did is we believe in storytelling. We believe, just like a minute ago, as I mentioned, I have lost my grandmother, right, from Alzheimer's. It is important that we have these conversations. It's important that we tell our stories. What did I endure? What did my mother endure as her caretaker for many, many years? We have to begin to start telling our stories, because us telling our stories, that is ultimately going to help the next person. That's going to help that Mr. Sixth Row in your congregation, right? Mr. Sixth Pew that you may not know, but if you tell him your story, you never know what he's been through. That might help him. Or perhaps Miss First Row Pew, maybe she's dealing with something else, but she doesn't know that you are in the third row and you've dealt with the same thing. We have to begin to tell our stories. I know, traditionally in the Black and brown communities, we keep our stories in the family, right? I know that. I come from a family with Southern roots. I know that we always, what happens in the house, what happens in the family stays in the family, right? But we need to begin telling these stories so that we can help the next generation. We can help our brothers and sisters who are still here with us to ensure that they have longer lives. So that's what we've been doing. We've been telling those stories. A couple of the nominations we received. The very first one was for, we had a campaign at the beginning of COVID-19 that was highlighting and really acknowledging those individuals in the Black and brown communities who were on the front lines. So at the, in March, April, May, June of 2020, as cases were starting to rise, and all of us were at home, there were folks that were still having to work in the grocery store. There were folks who were still having to drive those buses, right? There were folks who were still having to do the custodial work in the hospitals. And if you walked into any of those facilities that I just mentioned, the majority of which were Black or brown, right? And so we wanted to make sure that we acknowledge those individuals. So what did we do? We reached out to our task force. We asked for them to submit photos to us, and we then highlighted individuals with their images on a commercial, a PSA, to say thank you. To say thank you, and that we see you, we hear you, and we acknowledge you. It was something very simple, but it was so profound. We received so many words of accolades and the like. Of course, we received an Emmy nomination just for acknowledging those that are in our communities that are doing the great work, right? We also worked with an artist, I believe wholeheartedly in the intersection of art and public health, because I believe that art can help tell that public health story. So we actually hired a poet to create a poem dedicated to these individuals. And it was his voice and his poem that was the backdrop to all these photos. So that was one of the ones that received an Emmy nomination. We also know that last year, and it has continued, unfortunately, many parents were not going to take their children to their pediatricians to get their regular vaccines, right? So we've been talking about COVID-19 vaccines, we talk about flu vaccines, but children have to get their regular vaccines, right? Like measles and mumps, rubella, that MMR vaccine that we all are aware of. And they weren't doing that because they didn't want to leave home, right? Or they didn't want to take that risk by taking their child in to see their pediatrician. And what we saw was the rate of vaccines administered for children drop. And what we do not want after living through the last 2 years of COVID-19, we do not want a resurgence of the measles. You do not want that at all. You do not want a resurgence of polio. We do not want that. So we created a PSA featuring a young Black girl and her mother. I specifically chose them because they represent the core of who we are as a Black community. A young Black girl in her natural hair, with her mother, with her natural hair, with images on the walls with Black dolls. It was really, really important that we create that public service announcement. And that not only received an Emmy nomination, but then it was so popular across the country that other states, they utilized our PSA and just took our name off of it and then put their name on it because it's federal dollars. So it's for anyone to use when we create them. And so we were very, very, very proud of that PSA. And then the third Emmy nomination, as I mentioned earlier, was about the addiction and recovery campaign that we did. It was called The Tennessee Faces of Opioids. That was something that I am extraordinarily proud of. And that is very close to my heart. I spent nearly a year traveling to all 95 counties in the state of Tennessee and interviewed individuals whose lives have been impacted by opioids. So those were mothers and grandmothers, fathers and grandfathers, individuals who are currently in recovery. I interviewed someone who had only been clean for 1 month. And I interviewed a woman who had been clean for over 35 years. Folks from the white community and the Black community, Hispanic community, the Native American community, folks who have never been out of poverty, all the way to folks who have homes bigger than I will ever live in, right? And it was important that we tell these stories. And what does addiction look like? What does recovery look like? Let's put a face to the data and the numbers that we hear about every single day on the news when someone has overdosed. Who is that family? What was their life like? How can we learn from their story? And we were so incredibly proud of that campaign. So that campaign was also nominated for an Emmy. So we were very, very proud about that. So I wanted to end on that high note of the work that we are doing in Tennessee. The Division of Health Disparities Elimination, my office specifically, the director, as the director of the Office of Faith-Based and Community Engagement. I'm going to throw a couple of websites out for you to take a moment to write them down. And again, these are all happening in Tennessee, but there is absolutely positively no reason why you could not replicate them in your area. So healthdisparitiestn.com. That is the website to our website of our division with all kinds of good information on there. Feel free to take anything that you see on there, replicate it in your community. If you have any questions, my contact information is there listed under the Office of Faith-Based and Community Engagement. Of course, as I mentioned, under that task force tab, there's funding opportunities. The majority of time when I post things on there, they are for anyone across the country. They're very rarely specific to just Tennessee. Vaccines.gov. That's vaccines with an S.gov. That's G-O-V. So vaccines.gov. Please, 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 please get vaccinated with your COVID-19 vaccine. We want to make sure that you are around. If Mr. Powers invites me back this time next year, I want to make sure I see all of your wonderful faces and see your names this time next year as well. We want to make sure that we ensure that is by you all getting vaccinated. We know the way viruses work, that they will come back around until everyone has been vaccinated, and we are starting to see that in certain places in the world right now. So there are certain places that are starting to see a resurgence of cases. And so what we don't want is a repeat of what we had about 2 months ago, if you all recall, when the hospitals were completely full. So please get vaccinated. And lastly, I always end these conversations with 3 of my favorite words in the whole English language, and that is, it's so simple. Wash your hands. I don't think it's as simple as that is to say. I don't think people understand how much disease and virus that they could eliminate. They could protect themselves just by washing your hands on a regular basis. Teach your children the importance of washing their hands. You wash your hands regularly. Every time you touch a doorknob, if you're out and about the grocery store, come back home, wash your hands. If you're not near soap and water, hand sanitizer also works. So with that being said, I know I wanted to leave some time if there were any questions that anyone wanted to ask, if they had any concerns or things that they want me to repeat, I am happy to do so.
Can you repeat the first website before the vaccines.gov?
Yes, ma'am. That is healthdisparities.tn.com. And that is to the Tennessee website. And so that's also going to give you all that information, as I mentioned, under the task force. There is funding opportunities. I failed to mention one other campaign that we've been working on called Our Voices. So just as we told the stories of individuals who are facing addiction and recovery through the Faces of Opioids campaign, we actually created a campaign specifically for our African American and Hispanic brothers and sisters across Tennessee called Our Voices. And we are telling those stories of those individuals whose lives have been impacted by COVID-19. What has the last 2 years been like for you, right? How has your life been impacted by COVID? Were you laid off? Were you working from home? Were your children at home? Did your business grow? Did your business fail? How has life been like? We want to make sure that we are capturing this for the history books. Mr. Powers mentioned that I am currently, among all the other things that I do, I am also in school, y'all. I'm getting my master's degree all at the same time. And one of the things that I learned in one of my classes last year, as we were studying the 1918 influenza pandemic, many of the stories that were captured, they didn't represent our community. They weren't told. No one captured our stories from our perspective. And I said, you know what, we need to do that this time around, because in 150 years, the next time another global pandemic comes around, I want to make sure that at least in Tennessee, our stories are told. So if anybody is watching this and you have any tie to Tennessee, whether you live on that border, feel free to submit your story on the ourvoicestn.com or through that website that I just told you, healthdisparities.com. You can link it to from there. So were there any other questions, Ms. Bobby?
No, ma'am. Thank you.
All right. Wonderful. Mr. Powers, were there any questions that you received?
No, I haven't received any in the chat from YouTube. But one other thing that we had talked about, you had mentioned prior to coming on, is shingles.
Yes.
And the reason why I want to bring that up, because it hit in my home a few weeks ago with my wife. She has shingles, and it was very painful for her. And she went through that for a couple of weeks, and it's very, very, very painful. And you can even die from that. So
you can. And so again, much like, as I mentioned, COVID-19 and the flu and pneumonia vaccines, there is the shingles vaccine. So if you are in that age range where it's important that you get that shingles vaccine, again, just like everything else, you can likely get it probably at the healthcare provider. So the shingles is not necessarily one that you're always going to find at a local health department, because it is super specific to that particular age bracket. So we would really encourage you asking your healthcare provider. Talk to your health, whether it's about vaccines, whether it's about what are the symptoms of shingles, what are the symptoms of diabetes. One of the things that we encourage, I am not a healthcare provider, right? Let me start there. I always joke with my colleagues, I just play one on television, right? I'm never going to give any kind of medical advice. I write a lot of talking points. I am a public health nerd, but I'm not going to give any public or some medical advice to anyone. So we tell everyone, talk to your healthcare provider. If you don't have a healthcare provider, find that local health clinic. They're called federally qualified health centers. They're all over the country. I'm sure, again, if you call your local health department, they can connect you with a federally qualified health center. If you cannot find an FQHC, you cannot find a clinic, please get with Mr. Powers. He can get with me, and I can at least reach out to my colleagues over there in Mississippi who can then help you. We actually happen to have a couple of staffers who came to us from the Mississippi area. And so I have resources that I can tap into to help find someone there in your area, a free clinic where you can get some advice and talk to somebody. But if you have a physician already, I cannot emphasize this enough. Please, please, please talk to your healthcare provider. You are your best advocate, right? If something does not feel right, ask them.
Absolutely.
There is no such thing as a bad question. My grandma, who, as I mentioned earlier, passed last year, used to always tell me the only thing that's a bad question is a question that's not asked. Mm-hmm. Always remember that. If there's something, you have an inkling in your belly, you're like, I don't know, I got a question about that. Ask the question. Nothing is too silly.
All right, thanks, Ms. Hart. Ms. Johnson or Pastor Marshall, y'all have any questions or anything?
I don't have any questions, and I pardon the block camera. I'm running unshaved and all that stuff. So, but I really enjoyed the presentation. I thank you. I think it's a good reminder in just mobilizing. We do have a health ministry and try to do a lot of what you're talking about. But even with that, we got a lot of work that we can still do. And I think the biggest thing I'm taking for it is that capturing. When you were talking about that, 100 years ago, there's not much about our story in it. Mm-hmm. It strikes home. And, I didn't think about it, but it's, even when you think about just the story of Memphis, that it would really be a stronger Black town were it not for riots and the flus and, different things that have happened. And our stories aren't really in those transitions. So we thank you for that reminder. I know this is a health ministry, the health presentation, but that right there just grabbed me that we need to be intentional in capturing what we do so that the next generation has it and don't repeat the cycles. Thank you.
Absolutely.
And then that's a great point, Pastor and Ms. Hart, because if we don't get the word out and educate our folks as well about these different, places they can go to get health issues taken care of and the resources as far as funding them, then because there's so much apprehension out there in our community already, but we got to be the ones who educate them so they cannot be so apprehensive.
Absolutely. So, October was Breast Cancer Awareness Month. If you are a woman or you are a man, because let's be very clear, breast cancer does impact men as well. If you received your mammograms, if you received your exams, tell someone. Shout it from the rooftop so that you make someone else comfortable with going to get that mammogram. For gentlemen, we know that this is also it's called Movember, I believe, where there are men who are not shaving their beards to bring attention to male awareness, male health awareness. The importance of getting your prostate exams if you are of that age. These kinds of conversations, we have to reduce the stigma of having these conversations. Get comfortable having these conversations with one another. So one of the best places to do it is start right there in your home, start right there in your church, and it's only going to spread from there, having those conversations. So thank you so much for taking away that nugget. My communications brain definitely appreciates you doing that.
Right.
We have to tell these stories.
Absolutely.
Well, wonderful. I really appreciate you all again for having me. And as I mentioned, my contact information is all over that website, but Mr. Powers also has my information. I am happy to talk with you one-on-one. Don't think that just because you're in Mississippi that you just kind of get away from me. I am here to help. I am a public health advocate. I've been doing this almost for 18 years now, and it doesn't matter where anybody lives. I'm going to try to help however I can. So please reach out to me if you have any questions whatsoever. You want to talk with me one-on-one, or you need me to try to contact someone there in Mississippi. I'm happy to do so.
All right. Thank you, Ms. Hart. Very, very great presentation you've given us this afternoon. So are there any more questions, any comments? I'll see you, Pastor.
Pastor.
He's gone now.
All right. Well, thank you.
All minds clear. I would like to close out with a scripture and a prayer. I want to come to you from 3 John chapter 1, verse 2. Beloved, I pray that you may prosper in all things and be in health, even as your soul prospers. Let us pray. Heavenly Father, thank you for bringing Ms. Hart into our presence to give us all this great valuable information that we need to pass on. Lord, look upon us with eyes of mercy. May your healing hand rest upon us. May your life-giving powers flow in every cell of our bodies and in depth of our souls, cleansing, purifying, restoring to wholeness, and strengthen for service of your kingdom. In your name we humbly pray. Amen. All right, that ends our presentation. Like I said, thank you very much, Ms. Hart, for taking the time out of your busy schedule.
Wonderful. Thank you all. You have a wonderful rest of your weekend.
All right, you too.
Bye-bye.
Amen. Thank you all.